So we kind of get into two different types of inflammation. Then we get into acute inflammation and chronic inflammation. So acute inflammation would be, again, you're stepping off a curb, you twist your ankle. You might get a little bit of puffiness, a little bit of swelling in your ankle, and it's there for right away, and it's there kind of through tomorrow. But then the day after that, it's gone. What your body was able to do was switch over from, it did what it was supposed to do. It brought that fluid in. The fluid came in to make that ankle a little bit tighter, to start to bring in some of the immediate nutrients that it needed to heal, to kind of tell you that something was wrong, create a little bit of pain for you so that you walked a little bit more gingerly the next day or so. But by 24 hours later, that swelling should be gone. And as a result, the pain should be gone, the stiffness should be gone, you should be able to walk normally, etc. When that doesn't happen, that's what we would term to be chronic inflammation. So chronic inflammation is something that either lasts for more than 24 hours or comes and goes over the course of time. And chronic inflammation is not a good thing. It's a sign that your body isn't doing what it needs to do to heal the area. Your body got stuck in this inflammation state or this swelling state. And so that chronic swelling collects in that joint. So sticking with the example of the ankle, it stays in that joint. It keeps the joint tight. It keeps there being pain and soreness there. It makes it difficult for you to walk normally. And worst of all, it's restricting the blood flow to the area, which is helping, which would help the other tissues in that area, ligaments, bone, etc., to begin their healing process. So what do you need to do if you've had swelling that you can actually see, or if you've had pain, stiffness, soreness that didn't go away after a 24-hour period, or that it's getting worse inside of that 12 or 24-hour period? You really need to get a good evaluation, a good assessment of what's happening in that area. And that's really where an expert physical therapist comes in here at Loudoun Sports Therapy Center and figure out what is causing the symptoms that you're having. How is the swelling responding? What's the cause of the swelling itself, and what needs to be done to get that under control? Because once we do that, then we can really help to give you a good plan of action on how to not only get rid of the swelling, again, whether it's visible or not, but to decrease your pain, get things under control, and get you back to being able to live life and do the things that you want to do.